Waking up to a child with a sudden high fever and a heavily swollen jaw is terrifying. When mumps strikes, the immediate parental instinct is to fix it and fix it fast. In that initial panic, parents often reach for two familiar comforts: whatever leftover antibiotics are sitting in the medicine cabinet and a soothing glass of orange juice. But reaching for those common remedies will actually make the child's condition significantly worse. To understand why, we have to look at what is actually causing the swelling. Mumps is a virus. That means traditional bacterial interventions are completely useless. This graphic illustrates exactly why those leftover pills offer zero benefit. Antibiotics are designed to attack bacteria, but as you can see, they simply bounce off the protective envelope of a viral structure. That means we must abandon the instinct to actively cure the disease with medication. Instead, the strategy shifts entirely to managing the symptoms day by day. Recovery depends on shielding the body from secondary agony while the immune system works to clear the infection naturally. Which brings us to the second major mistake: trying to load the child up on vitamin C with sour citrus liquids like lemonade or orange juice. A citrus trigger like a lemon forces heavy saliva production. In mumps patients, the salivary glands are physically obstructed. When new saliva slams into a blocked gland, pressure builds instantly, causing excruciating pain. The rule is absolute: strictly avoid sour foods. To prevent that pressure buildup, the salivary glands must be kept completely dormant. The patient needs to transition immediately to a soft, bland, liquid diet. With the diet corrected, we can address the fever and the aches. Since we know antibiotics won't work, we rely on targeted over-the-counter medications to control the discomfort. This RX blueprint outlines the exact pharmacological strategy: a combination of paracetamol and ibuprofen.
Dosing must be calculated strictly by patient weight and administered 3 times a day. Crucially, the bottom note confirms this regimen is exclusively for symptom relief, not fighting the disease. Real comfort comes from respecting the anatomy. Stop the gland from working by removing sour triggers and chemically dull the inflammation so the body can rest. This entire process of managing the diet and controlling the fever requires strict discipline, and it all takes place within a highly specific 5-day window. Here we have the 5-day mumps management blueprint. This chart maps out the framework parents must follow to safely navigate the virus's life cycle. The most critical requirement is at the top. For the first 5 days, the virus is highly contagious. Strict isolation is non-negotiable. In the medication tier, the paracetamol and ibuprofen regimen is concentrated at the beginning. As the fever breaks around day 3, painkillers taper off. The bottom row's home care protocol, warm compresses and a bland diet, must be sustained rigorously every single day. This grid contrasts the correct holistic protocols on the left against the dangerous mistakes on the right. The biggest hazard is in the bottom right. Sending a child back to a crowded classroom before the 5-day isolation is complete risks massive community transmission. Managing mumps is a waiting game, won through discipline. By strictly managing the viral life cycle and avoiding unnecessary interventions, we ensure the infection remains contained and the child recovers safely.